Dr. Bitange Ndemo continues with me here in studio. You know him as a former permanent secretary in the Ministry of Information and Communications. He's now an associate professor at the University of Nairobi. He is the chairperson of the Blockchain Task Force, among other titles that he holds. And first things first, Daktari, the question everyone's asking is certainly what happened to, we see a bandage on your head, and a few questions have been thrown my way on 22422. Maybe you can help our viewers understand?
No, I had a small growth which the doctors decided to remove.
Okay.
And because of my passion for the big four, I had to come.
You had to come.
I wanted to give an excuse that I have some surgical procedure on my head, but I said I will come.
You will come.
People get bandages here and there.
Thank you for honoring our invitation. Of course, you're a man of interest, so when Kenyans see this on your head, they definitely do want to ask questions. Thank you for clarifying that. We do have some graphics that we'll be playing for you briefly about the big four. We know it's about manufacturing, we know it's about housing, we know it's about healthcare and food security as well. In a nutshell, because we may not be able to get deep into them, of all these four, and maybe the first question I should ask is, why do you think the title Big Four is so appropriate for them?
Because it's big. We are approaching the fourth industrial revolution, and I think the president saw it wise that manufacturing becomes part of the big four, and it must be about big four because that is where the jobs will be created, and they can be created very, very easily if we leveraged on technology. That's why I look at it as very big. Number two is that if you look at the budget of housing, I mean, rent for many people eats up more than 30%, actually 40%, some even 80% because they have to get money from other sources to pay for rent. Number two, look at the food budget.
So and I'm trying to do this math now. So 30 to 40% goes to rent, yes, for example.
Yeah.
Okay.
Food budget eats up 45 to 50%.
What is left then after you pay rent and you eat food? 45 to 50%.
That's why when you throw in health, you are into borrowing or getting relatives to raise money.
Mobile loans, etc.
Actually, many people, the harambes you see in the city are for health because nobody affords it. You see somebody's being taken to India, somebody surgery at Kenyatta, somebody whatever. People are permanently doing this. And the president saying that we will take care of health, you free up a lot of cash for people. And if we manage to lower food budget, and it can be lowered, because if you remove the number of middlemen in our food chain, you would actually pass that benefit to the consumers. We tracked something from Nakuru, tomatoes and whatever. By the time it lands in Nairobi for the retailer to sell, the price has gone up by 400%.
400%.
Yeah. If we are able to work around this, reduce the amount of waste so that the farmer gets value for it, and then the price to the consumer becomes lower, we lower the total budget of household. That is food security.
In your view. Of these four, of the big four, and they've been narrowed down because Kenyans have a lot of issues,
yes,
which one do you think, or do you consider as the lowest hanging fruit? The easiest achievable in the next 4 years?
I actually did an article that actually all of them are lowest hanging.
They're all on the same level.
Because health, if we are all honest, very honest, the government can afford to offer NHIF. But we have complex ways of health in this country. The doctors here, to see a doctor like I saw a doctor.
Like you saw a doctor recently.
is 4,000 to visit a doctor.
Yes.
You go to India, it's 200 bob. I mean, if you are able to see many patients, you can raise that money. Hospitals, and I've done articles on this, how they inflate costs in the hospitals. You know, they bring a bunch of, if you look at your bill from hospitals, almost 20% are lies. Because how do they, for example, say, we used 1,000 gloves on you? It's just like everybody who walks in wears gloves and comes in.
Are you talking about a real bill that you've seen?
Just get any bill and see. If you are admitted and look at how many gloves that were used on you or the price of medication, why must they mark it up so much? There are several middlemen that cause the price of health to be so high. That's why I'm saying, if we are very honest, we can actually lower that cost so that we can be able to lower the cost of insurance. Everything goes up because even when they estimate, it's from the numbers that they get now. When I talk about removal of the middlemen, there are technologies that can enable us to remove. 100 million people die in Africa because of fake medicine. This is people go and bring counterfeits and we take this. We can remove that. We can remove that and be able to lower that cost of medication to the people. And that's why I'm saying all of them are big, because food, we can develop the supply chains and lower that cost without even increasing the acreage. It's not, the issue is not about the acreage. The issue is around waste and the supply chains, which have made it very expensive. Housing also, it is a must that we must begin to urbanize. We must begin to provide affordable housing. This is the only part in the world where we get stones from, destroy our environment, put stones. Why do you need so much like that? If you go to other countries, they have other methods of using other materials that are much cheaper.
Prefabs and the like.
Prefabs and doing that. If we had good security, those prefabs can be accepted, which are much cheaper by almost 200–300%, and people can afford housing. So they are all low-hanging fruits that we need to take advantage out of the many things that we
Doctor, you're not the first guest to sit here and walk me through innovative ways of applying and taking the Big Four from a discussion on paper to a reality. But the fact is, it still hasn't happened. And although it's still early, and we have another 4 years and you can wait for that, but there are two things we need to look at. First of all, we need to look at how, for example, the Jubilee government did development over the last 5 years to understand how they will do it moving forward. Because for me to tell you your future, I need to look at your past and I can then look at the trend. And I believe that's a scientific approach. My question to you is, if you look at the Jubilee government over the last 5 years, do you see any development mistakes that you hope will not be carried into the implementation of the Big Four?
Well, I didn't come to assess Jubilee, but
government, let's say government.
I actually look at way forward. If you look at the Vision 2030, it was developed a couple of years ago. We made a lot of strides in this. And actually, this is the more important area that we should have looked from the beginning. We were talking about value addition, meaning we can be able to reduce the waste, and most of this food can be, we can delay consumption, the farmers get their value. And this is what we are not doing in this country. In industry, we have talked about it all through. I think this is the first time we are saying we can take it very serious. And there are some soft areas where government needs to listen. We don't need a lot of money to do housing. We just need to say, here is the incentive to the private sector, put up the housing. If you are not able to sell it, we'll buy it. But this is the price we are looking at. Or show us the technologies that you want to deploy, and we look at this. You would actually be able to do it very easily. On health, as I said, we need to deploy proper supply chains. When you have every county buying their medicine and whatever, inflating the cost to the consumers, even if you provided the NHIF, the cost will still be very high.
How will you convince health practitioners to go to the ends of our borders? We've heard reports that in some of the far-flung counties, specialists don't want to go there.
They don't want to go there.
It's not lucrative.
And then they are refusing doctors from Cuba
to come in.
It's somebody like me who understands economics. It's actually nonsense. Our nurses are getting jobs in London, working in England and earning from there, sending money from the diaspora. And then we are refusing to accept the doctors to go to places where we can't go. I think it's hypocrisy. We should begin to think as a free market economy that offer your services, you would actually get what you are worth, you know. People are going to India because our doctors are damn expensive here.
That's the truth of the matter.
That's the truth of the matter. So nobody's addressing it. We need to address it so that even them, they begin to think about the citizens first.
Okay.
Yes.
I know you're not a prophet, but this is a difficult one to ask. Is there any chance that the implementation of the Big Four, in your view, if it is not finalized, if we don't achieve what we're hoping for, what do you think would have been the barriers?
The barriers is the truth is that there are cartels in this country.
There are cartels.
There are cartels. If the government allows the infiltration of those cartels, then we will not realize this. The cost would again be blown up with this. I think you saw the president in Tinwek, where he saw a huge project for 300 million. But a similar project in government will cost like 3 billion. It's because there are too many, as I said, middlemen who say, me, I need this, I need that, I need that.
So the biggest danger to the Big Four, middlemen and cartels,
yes,
they're allowed to operate then.
If that is removed and we have the right people to put up the housing, the people with technology, not the middlemen who have gone to acquire technology to come and also add their cost on top of it, then we can reduce the cost of housing.
How important is public participation in the implementation of the Big Four? And I'll give you an example.
Yeah.
On Monday night, we had a team from the Nairobi Regeneration Committee here on, hosted by Ann Kiguta. The next day, I brought in some stakeholders of Nairobi County. I brought in the NCBDA chairperson. I brought in the KARA CEO, the Kenya Alliance of Residents Association. And they said that the challenge that that committee is making is that they are giving orders to Nairobi residents that this is what we are going to do. So Nairobi residents think that it is them transforming Nairobi, while transformation of Nairobi should be an all-inclusive process. Do you feel that Kenyans have owned the Big Four agenda, or do they feel that it is President Uhuru's and his alone?
The president has a right to have a vision, and it is the leader who sets the vision.
Who sets the vision?
Because the Big Four agenda impacts virtually everything. If your food cost is much lower, you have enough money to pay school fees. You see, this is what I'm trying to say. If your health cost is come down, you have some resources to do other things that you are not able to do. So his vision is very clear. We should actually look at it very seriously. The problem is that we have not explained to the citizens the impact of the Big Four, and that's
in very simple
what we are
language
trying to do.
That will make sense.
In a very simple language, that we are part of the solution. You know, you go to hospitals, they can tell you that sometimes someone dies and relatives come, they say, no, this is not the one who died. We just used someone is NHIF to do this. So that's why I'm saying that if we are honest, because we are desperate, we don't have resources for help, and that's why the Big Four is very critical for this nation. Yes.
Okay. Daktari, make sure you give me another appointment so that we can get deep into each of the four. But before I let you go, you recently wrote an article, and you told me off camera that this got you in trouble, warning the political class that Kenyans are watching them and paying attention to their excesses. The funny thing is, your article came out at roughly the same time as a proposal by MPs to increase their pension paycheck by 700%. You also warned that citizens could get tired very soon. Maybe let me allow you to say it in your own words.
There is a difference before and now. Now so many people have knowledge. I pumped into these young people who have gathered all these headlines, you know, MPs demand 12 billion. MPs want to raise their pension by whatever. They recently raised their salary to, they hiked it, and they've been hiking their salary. There is a threshold where people get to a point and say, this is it. And we are courting trouble if we keep on seeing there is a group that is privileged to use public resources for themselves. So that's why I was saying that it would get to a point and the people will be so angry with you. We've seen happen when Mao Zedong was removed in China. We saw that happen. You saw in France during the French Revolution. So this is something that happens as we have taken people to school. They understand, they read widely. I'm just reminding the MPs that
history can repeat itself.
History would repeat itself so easily. And I'm not just talking about MPs, I'm talking about the opulence that governors are exhibiting across the country, you know. I'm not the one who used the word opulence. The conference in Kakamega, the newspapers were talking about opulence.
Show of wealth.
Yeah, show of wealth,
flashy cars.
power,
yes.
you know, MCS arriving with 4 wheels, the governor with whatever.
With a convoy of 4 wheels.
Convoy of 4 wheels and chase cars and stuff. Why would you, in a one-street town,
need that
have
stuff.
a chase car, a siren ahead of you? Who are you running away from? Yeah.
I think I'm gonna ask the next governor who comes here that particular question. But you have definitely made your point. Fascinating conversation, Dr. Bitange Ndemo, Associate Professor, University of Nairobi, and the Chairperson of the Blockchain Task Force as well. Thank you for finding time
to
be here with us today.